If you're looking for exercises to relieve neck pain, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain 8 different exercises that you can use to relieve neck pain and stiffness. Now, there are lots of different things that can cause neck pain, the most common of which are stiff muscles, joint problems, or pinched nerves. So probably not every single exercise is going to work for every person, but I'm going to do my best along the way to explain which exercises may be appropriate for what type of symptoms. Now, there are some more serious things that can cause neck pain, including problems with your spinal cord or the arteries that go up to your brain. So if you're having symptoms like dizziness or nausea, double vision, trouble speaking or swallowing, numbness in your face or your hands or arms, or sudden weakness in your arms or legs, or if you can't maintain your balance, if you're falling for no reason, or any other symptoms that you find just unusual or strange besides just neck pain or stiffness, then check with a healthcare professional before doing these exercises. But now that that's out of the way, I want to start with one of the most common exercises that people do for neck pain. And if you've ever been in physical therapy or heard anyone talk about neck pain, probably one of the most common things that people will talk about is the chin tuck. And a lot of people do this exercise wrong. Forward head posture like this, or to see it from a side position, forward head posture like that, is a cause of many different types of neck pain. But the solution to forward head posture is not pulling your head back like that, like a chicken. The solution to it actually comes more often from your upper back. If you're working at a computer for a long time or driving in a car and you're hunched over at your upper back, this forward head is actually a compensation for what's going on in the back. And so the forward head is not the problem, it's the compensation for the problem. And in order to fix the root cause of the problem, you really want to start in the upper back. And sometimes that even goes down lower into the lower back or sometimes even into the legs. So it is important to look into the root cause of the problem. But to fix a forward head, you want to sit up tall, kind of lift through your chest, not arch at your lower back like that, because that can create lower back problems, but rather lift up through your chest and through your sternum. And then you'll notice, or you may notice, that you're looking up towards the ceiling. And that comes because of stiff muscles in the back of your neck. Then you want to make a little tiny head nod, just bringing your chin down slightly, like that, with the axis of rotation through your ears. So it's not a big chicken neck or something like that. You just want to straighten up from the chest and then nod your chin down that way. Now, if you notice that you're having trouble doing that, and it should be a small, gentle motion of nodding your chin down, then it's likely that you have stiffness in these muscles, called the suboccipital muscles. Sub meaning below, and occiput meaning your skull. So they're the muscles right below your skull. And if you're having headaches, then that may be a cause of your headaches, those muscles right below your skull. Now, to get those muscles loosened up, in addition to help you bring your chin down like that, there's another exercise, and this is the second one, and that's where you do that little chin nod, then take your hand and kind of pull down like that. So you're just gently pressing on your forehead. You're not pulling down this way. You're actually kind of compressing with your hand on top of your head and pushing backwards that way. So you push backwards with your hand and then just a slight downward motion. And what that does is it helps isolate this motion to the neck. So you're just nodding through the upper segment of the neck. So you can see it this way. You put your hand on top of your head, do a slight push downwards. Again, not pull downwards like that. Push inwards, then just a slight pull. And you should feel that right there. Now you can bring it down lower just by pulling up this way and going a little bit lower in the neck. But again, you're not pulling forwards. You're actually pulling an upward traction to get lower in the neck. And so that's sort of a segmental flexion or a segmental forward bending. this forward bending motion like this, we call that flexion. And you shouldn't bend your neck just all as one unit downwards like that. It should sort of roll one segment at a time. So this helps you roll the upper segments in your neck by pressing down on the head and nodding the chin down, and then roll the lower segments in the neck by nodding down that way. So that's the second exercise. And both of those, if you notice, are the movement of flexion, going downwards that way. Now, the next exercise works on the opposite movement of extension. Most people don't actually need to do extension exercises for their neck. And actually, that's bad in a lot of cases because as you start to get older, you lose that ability to go upwards, that upwards extension motion. It jams the joints in your neck together. If you look at how the facet joints in your neck are lined up, they kind of sit on top of one another. And so when you extend backwards, it kind of jams those joint spaces together. Additionally, when you bend backwards, it narrows the spaces where these little yellow nerve roots come out of your neck. So it starts to pinch on the nerves in your neck. Additionally, when you sit with a forward head posture, you're already in extension of the neck. So neck extension is probably not a good exercise for most people. But what is good is upper back extension or cervicothoracic extension. And the reason for that is when you sit with a forward head, you're in extension in your upper neck and middle neck and flexion in the upper back. And so trying to get extension through here is good. And one really easy exercise you can do to get more extension through your lower neck or upper back is sitting with your back in a chair like this, putting your hands up behind your neck, kind of clasping your neck. And you actually want to kind of tuck your chin when you're doing this. So you're slightly flexing the neck while extending at the lower part of the neck and the upper back. And so what that'll look like is chin tuck, flex the neck, and then just a slight lift through the chest, extending through the upper back while keeping the chin tucked. You can put your fingers down at the base of your neck like that, acting kind of like a fulcrum, and then just extend over your fingers. That's an alternative way to do it. So that's the third exercise, and that one is for upper back or lower neck extension. Now, the next movement that we'll work on is neck rotation. And this is good for people who have trouble, say, checking their mirrors, or if you wake up in the morning and you notice that you're having trouble kind of looking over your shoulder. This is really good for that type of problem. Now, the way that a lot of people instinctively turn their neck is they kind of combine an extension, side bend, and rotation movement. So they look kind of like that. And what that does, if you look at the joints in the neck again, it sort of jams those facet joints together and can even pinch the nerve roots in the neck. So that combined extension and rotation is not a good movement pattern. And so what you want to do is actually sit up with a good posture through your chest, slight chin tuck, again, not chicken neck, but slight head nod. And then just act like there's a rod running through your head. And you're just spinning around that rod, side to side, so chin to shoulder, chin to shoulder, chin to shoulder, chin to shoulder. Just go back and forth 5 or 10 times each way. You don't want to push this. This isn't a push as far as you can go. Just nice, easy movement. You can probably get farther, but if you start to go farther, you'll usually start to use those compensatory movements that you're trying to avoid. So this should be a nice, gentle, easy motion. Now, if you notice that you're using that gentle, easy motion and you just still feel stuck. You just can't get as far as you'd like to be able to get. The next exercise is to help you get a little bit farther. And for that, what you'll need is just a basic hand towel. And you'll put that towel around your neck like this. And you can use it at various different levels in your upper neck or lower neck, depending on where you feel the stiffest. But most of your rotation, about 50% of your rotation, comes from the joint just below your head. And so what I'm going to do is show you how to do this for that C1, C2 segment. So what you'll do is you'll reach across your body, and this gets a little confusing of the hand placement. So you'll reach across your body, and in this particular situation, I'm going to turn my head towards this side. So you reach across your body and grab the towel on the side that you're turning to with the hand opposite of the side that you're turning to. Next, you reach over top of the first hand with the other hand, and you grab the towel. Then you bring it across your cheekbone. You pull down with the hand that's by your chest and across with this hand. Again, this should be a nice gentle motion, but you should feel like you're able to get a little bit farther. You can kind of isolate the stretch by playing with it, moving your chin a little bit more down, chin a little bit more up. If you feel like you need to move further down into the spine, you can move the towel further down, some more on your chin, like that. But that's just a nice way to kind of do sort of a self-mobilization exercise. If you were in physical therapy at our office, we might use our hands to kind of help twist your neck or help get your joints in your neck moving a little bit better. But since you're watching this at home right now, this is a way that you can kind of mobilize your neck on your own. Because you are kind of going into farther degrees of rotation with this, be mindful of any of those strange or unusual symptoms that I mentioned back at the beginning of this video. You should just feel a comfortable stretch in your neck, and that's pretty much all you should feel. Additionally, if you're turning towards one side and the arm or the hand starts getting numb or tingly, or you start feeling symptoms in that hand or arm, don't go that way, because when you're turning towards a side, it kind of narrows the nerve spaces on that side. So that's the assisted neck turning exercise. Now, for the next couple movements, we're going to go to the side bending motion. And one of the most common stretches that I see people do for their neck is just kind of going to the side like that, or going to the side like that. Now, what that does is it is supposed to stretch your upper trapezius muscles, or if you go down a little bit more like this, it's supposed to stretch your levator scapula muscle. But in reality, that treats your neck kind of like one segment, like you're moving all at one joint. But remember, your neck is made up of 7 different vertebrae, and you should be moving at each of these vertebrae. So it should be more like a C curve, not just a hinge. And when you stretch your neck the way that I just showed, you kind of move everything all at once, as if you're pivoting around one point. And so to do more of a C-curve neck bend, you can just actively tip your head and imagine the axis of rotation being here, or there, or there. So you're kind of moving through one joint, then the next joint, and the next joint, and the next joint, and the next joint. And so you're kind of moving in more of a motion like that rather than just hinging everything. And usually when you stretch more of a gross stretch like that, you tend to move more through the segments that already move enough, and the segments that are stiff, they stay stiff because you're just moving where it's easy to move. Now, if you need a little bit of overpressure, you can take your hand and put it up on top of your head, put a little bit of pressure like you did with the flexion exercise. So you put a little bit of downward pressure, tip to the side, and then your direction of push is across. So you push to one side, move down a little bit farther, push to the side, move down a little farther, and push to the side. So again, you're kind of stretching one segment in your neck at a time. You're not doing all the segments at the same time. Now this opens up the joints on this side of the neck. It also widens the spaces where the nerves to this arm come out of your neck. And so if you're having sort of a pinched nerve sensation in this hand, then that may be a good exercise to help open up these spaces without excessively overstretching the nerve bundle or brachial plexus that runs down through your shoulder. So again, just segmentally open up those segments on this side. Now you should note that it also closes down the joints on this side. So if you're having bilateral hand numbness, this may not be the best exercise for you. And to go the other way, you just put your other hand up, tip to the side slightly, compress through. Move down a little bit farther, compress through. So again, you're pushing downwards this way. You're not pulling over like that. Pushing compression through the head. Side bend just a little bit more. Compression through the head. And you should feel the stretch move farther down in your neck as you go. Again, one segment at a time. Now, sometimes when you're having neck pain on one side, it may not actually be that the muscle's too tight and needs to be stretched. It may be that that muscle is already chronically overstretched. And you might notice that if on your painful side, if the shoulder blade is a little bit lower on that side than it is on the other side. And if that's the case, it may mean that you're overstretching the neck muscles on this side, which also kind of compresses the joints on that side, or it overstretches the nerve bundle, the brachial plexus that runs from your neck into your shoulder and then down into your arm. And you don't want to overstretch things that are already overstretched. So if that's the case for you, then you don't actually want to stretch those muscles, you want to shorten them. And a way to do that is just by reaching your arms up in the air and going up like that, reaching up towards the ceiling and actually kind of shrugging the shoulders up a little bit that way. You can slide your arms up a wall or up a door. You can just do it sitting in a chair like this, kind of reaching up towards the ceiling. If it is just on one side and you only want to stretch one side at the time, you can also put one arm up in the air and reach up just on that one side. And that way you can feel a stretch kind of underneath the shoulder blade and the lats, which sometimes pull that shoulder blade down. So that's a stretch for if you have a overstretched neck muscle. In that case, you don't want to stretch the neck muscles. You actually want to stretch the muscles that are under here that are pulling your shoulder blade down and overstretching the muscles in your neck. Now, for the final exercise, this is for someone who has a stiff first rib. And you may feel that like you've got tension in your upper trap muscles, but it actually may be the scalene muscles right here in your neck that kind of pull the first rib up. And particularly if you have a shoulder that's overstretched or lower on one side, you don't want to further stretch over that way and overstretch that muscle. So a good way to stretch your scalene muscles, as well as to help mobilize the first rib, is by using a long towel or a belt or a mobilizing strap. I'm just going to use a stretching strap in this video, but you can use a beach towel or a bath towel or a thick leather belt, or I'll also put a link where you can get one of these in the comments here. So you take the belt or the strap or whatever you're using and you put it up over your shoulder. You want to pull this close to your neck. You don't want to pull it out over the shoulder, which oftentimes is already pulled down too far. So you're going to put this up by your neck and kind of pull it across your body like a seat belt. So you're pulling down right there. And then again, it's just sort of like a little segmental tip of your head like I showed with the first side bending exercise. Just tipping until you feel a stretch right in that area of your neck. If you start feeling it past the belt or past the strap out into your shoulder, you've gone too far. So this is actually just a very small head nod where you're pulling the belt down towards the opposite hip, just tipping to the side like that. And I usually tell people just do 10 or 15 repetitions, not really holding it that much, just a nice gentle back and forth mobilizing motion that way. So those were the 8 exercises to help you relieve neck pain. And just to review those were the chin tuck, but not chin tuck like that, coming up from your upper back, and then just a slight nod of your chin. Next was the segmental flexion, where you put your hand up on top of your head, you push down, and then just segmentally flex, or kind of pull traction upwards like that, and flex down that way. The third exercise was for extension, where you sit with your back up against the chair and you cup around your neck and arch up that way from the upper back. The fourth exercise was that precise rotation, where you rotate chin to shoulder as if you're spinning around an axis. The fifth exercise was with a towel, turning your head side to side like that. So just a self-mobilization in the rotation direction. The sixth exercise was the segmental flexion, where again you push down with your hand, kind of pushing in that direction while just doing a segmental side bend, and then side bend a little bit farther. And again, that stretches this side. The next exercise was for a shoulder blade that's too low, reaching both arms up in the air and shrugging like that, or just doing one arm at a time. And the final exercise was that first rib mobilization or scalene stretch, where you pull the belts or the towel over your shoulder, across your chest, down towards the opposite hip, and then just do a slight side bend that way. So hopefully you did find those helpful. If you need more help for neck pain and you're in the St. Louis area, feel free to reach out to us at More for Life. And no matter where you're watching this from, if you found the video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.